My name's Christopher Sanchez, and I'm an orthopedic surgeon. And I really chose the field of orthopedic surgery for the simple sake that you see a problem and you fix it. And I really enjoyed the immediate response that I would get from patients who came to me with an issue, and I was able to serve as a source of a solution for them in a very, very meaningful way. In my particular practice, I see myself with a very wide base of patients, anywhere from the adolescent athlete all the way up to the elderly who are suffering from osteoarthritis. So my practice in general is a very wide-ranging one. Deal with fractures and your common ailments with that, as well as the osteoarthritic patient who has a bad hip or a bad knee or a bad shoulder, and we'll replace those. In general, the practice that I see myself in is one of very wide-ranging. With orthopedics, I would maybe like to take it all the way back to is why I chose medicine as a whole. I feel that there are times where people come to you with a problem and they really have no hope, and I can serve as that source of that hope in being able to really fix a problem that they can't go anywhere else to fix. And as I made my way through orthopedics and my medical career, I found that that was a huge draw, because I really did end up with a skill where I could help someone who had really no hope for the future in terms of fixing their problem. And as I've gained skills through my training, I found myself really intrigued with that, and it's a very fulfilling field to be able to show somebody what their problem is, and then tell them with some confidence that I can actually serve as that portion of the solution that they're really looking for. And in conjunction with that field, I suppose it's very fulfilling for me just as much as it is for the patient. With the way that medicine has been changing, one of the things that I really enjoyed about Paradigm was that it went back to truly the patient-provider relationship. Having come from academic institutions and very large institutions in general, you lose kind of the intimacy, if you will, of medicine. And one of the great things that I enjoyed about Paradigm was that the team that we use is one that is very familiar with both each other, and we're here really truly for the patient, and we bring that back down to the individual itself. I believe that patients in general really enjoy that because they feel part of it, not just another portion of an assembly line of medicine, but rather very, not cookie cutter, but very unique for them. And in general, that's, I think, what people are looking for. They're looking to be treated as a patient that's an individual, not someone who's just there to get fixed. And for me, that was really the lure of Paradigm in itself. I knew that I wasn't going to be that most famous person in the world, but I didn't need to, as long as I was important to the patient, and that was my drive, really. With osteoarthritic conditions, in general, you're looking at a degradation of the joint surface itself that leads to significant pain, loss of range of motion, and really just that ailment that bothers you all the way from the morning until the end of the night, and sometimes all the way through your sleep. What I've found is that through the reconstruction procedures that we do have, whether it be your knee or your hip or your shoulder, we really see a huge gain in function and really quality of life for the patient. That's probably one of the main procedures that I really enjoy the most, because the dramatic change in the patient's demeanor, again, their quality of life is so much of a stark contrast from pre-procedure to post-procedure. So when they show up in my clinic and you've really done everything you can to stay away from having to make it to the operating room, I find that those patients specifically are the ones that really benefit from that particular procedure the most. In the end, you know, it is a tough procedure, and I won't deny that to any patient. It's a huge thing to undergo, but the benefit from that really is giving you your life back, and no longer is that osteoarthritic joint really serving as the main force as to your decision-making process as to why you would go about, say, enjoy your family, go on a big trip. You're able to just get back to your life again, and that's wonderful to give back to patients. With the osteoarthritic conditions that we do treat, it's nice, especially with the Paradigm system as a whole, to be able to have different facets of non-operative modalities that you can offer patients, and they don't have to go somewhere else in order to get it. It's something that's right next door. It's something that you can immediately offer them, and and the people that you send them to are people that you really do trust and are going to be able to give them the same kind of care that I would hope that I would be able to give my mother. In the end, once all of those treatment offers have really kind of either failed or ran their course, it's really nice to give them the most intimate, the most comfortable setting with the best service, with people, again, that I would trust them with my mother when it came down to finally choosing to have that joint replacement surgery. And then when we finally do, we do the best in providing that care and eventually getting to the point where ultimately the whole point of it all is to be successful. And that successful surgery that ends up leading to a better quality of life for the patient and hopefully as much of an enjoyable journey through that process as we can provide.